Wanted to talk a little bit about things going on kind of on the other side of the world, and to take a journey from East Asia to the Mediterranean to look at a couple of other countries and their experience with recent variants and BA.5, just to see what the impact of these recent variants has been across other countries. So first, wanted to start out with a study that just came out in Nature Medicine, another study that's adding to our knowledge about long COVID. This looked at long COVID in adults who had COVID but were not hospitalized, and looked at a relatively large cohort. You can see that there were almost 500,000 COVID infected persons in this cohort and almost 2 million comparators. You can see that the relative age of these folks is young. So these are middle-aged adults, and span the range of adults all the way down to 18. You can see a relatively diverse ethnic representation, a little more skewed to white populations than the total US population, but also a relatively good distribution of socioeconomic indicators as well. And what this found was similar to other reports, a relatively high incidence of long COVID symptoms in those who had experienced or who were infected with COVID compared with those who were not. And you can see that in the middle graph here, these are odds ratios. So how many more fold actually it's a hazard ratio. The risk was, or hazard was, that a person who had previously experienced COVID would have one of these long-lasting symptoms. And again, these were symptoms at least 12 weeks out from recovery. And you can see almost all of them across the board are greater than 1 and outside of the error bars. So that means a statistically significant association with having COVID. You can see up at the top, and I've expanded that one, respiratory symptoms, particularly shortness of breath at rest, dramatically elevated, about twofold, a little more than twofold, compared to folks without previous diagnosis of COVID. Loss of smell, or anosmia, you can see there where one of the big red arrows is, also very significant, almost threefold increase in that. But a couple of other observations which have not necessarily been highlighted in previous studies were issues with sexual function. As you can see where the other arrow is, was significantly impacted, again, 2 to 3-fold in people experiencing long COVID symptoms. And again, these are not senior citizens. These are otherwise previously healthy middle-aged adults. And so across the board, again, we are seeing more and more confirmation that infection with SARS-CoV-2 virus has long-standing and potentially significant health implications long after the acute infection resolves. And so folks who are celebrating the fact that we're having lots of infections and maybe not as many hospitalizations, I think, are missing the point that these infections still result in significant health consequences, both for individuals and also for the health system, who is winding up managing all of these long COVID syndromes. So moving on, we'll talk a little bit now about the experience of COVID in a couple of countries that I think reflect how the new variants are behaving. So this is the current daily case count, 7-day average curve for Japan, and you can see that they have experienced a dramatic rocket upwards of daily cases associated with the BA.5 variant. Again, the highest number of cases per day that Japan has experienced since the beginning of the pandemic. You can see the previous experience with BA1 and BA2, and BA1 dwarfed any of their prior daily case counts across the pandemic. So BA5 is reflecting the fact that it is not only able to outcompete the prior Omicron and BA2 variants, but it is even more transmissible and able to spread more readily in populations that have relatively good immunity. And we've discussed the fact that Japan has done a very good job of providing vaccines and boosters for its population. They got a much later start than we did, but they caught up rather quickly. And just to confirm, it is BA5 that is now the predominant strain that is circulating in Japan, as you can see here from sequencing data. I would ask all of you to kind of look at that bottom right curve and to look at the impact of Omicron or BA1 in terms of deaths per day per capita in Japan. By far, Omicron BA1, that very mild virus that folks were talking about back in the winter, by far had the highest number of deaths associated with an epidemic wave in Japan compared to prior variants. And this was, again, in the setting where they had widespread vaccination by that point. However, they had case counts that far exceeded anything else that they had seen previously. And just highlights, again, that point that I've made a couple of times, is that you can make up in volume what you lack in individual lethality and severity. And that's what we saw with BA1. Just to compare, however, we should put it in the context that Japan, even though those curves looked awful, has done consistently much better than the United States. Even in that BA1 Omicron wave, you can see the US had many more deaths per capita associated with that wave than Japan did, because of their ability to implement appropriate non-pharmaceutical interventions. South Korea is experiencing a similar upward shot. Again, in comparison to the BA1 wave, not nearly as significant. And you can see South Korea kind of had BA1 and BA2 hit sequentially right on top of each other. So they created kind of one large wave, but they had gone down to a pretty low daily rate of cases until the BA5 wave. Similarly, you can see BA5 is now the dominant strain circulating in South Korea as well. And again, I will point to that very mild Omicron virus that we were all so happy was going to immunize the world, hit South Korea a bit later, peaking in March there, but you can see by far the highest daily death toll that South Korea experienced throughout the pandemic to date. And I would also, again, point out that if you're looking for a relative comparison, South Korea and Japan still both far have exceeded the US in their performance in how they've managed the pandemic, and that is reflected in their cumulative COVID deaths per capita. So again, normalized for population, and you can see South Korea is more than six-fold lower. Japan essentially 12-fold lower COVID deaths per capita than the US has experienced. So still, despite the severe waves that they're seeing now, nowhere near the total cumulative effect that the US has had. And now we'll go to the Mediterranean side and look at Israel. Again, similar experience in Israel in terms of daily case counts. Omicron or BA1 was by far the most, the largest epidemic wave that Israel saw during the pandemic. BA2 saw a more modest spike, and now BA5 seems to have peaked and is going down in Israel, which is good. And this just reflects just the idiosyncrasies of the different variants and how they behave in different populations in terms of vaccination timing, and there's a bit of biological randomness in here as well in terms of when these variants catch and take off. But you can see the pattern is relatively similar. Again, BA5, oh, sorry, that's South Korea. Am I going backwards? No. Yeah, this is Israel. So you can see that BA.1 Omicron, again, that very mild virus, the largest number of deaths associated with that epidemic wave compared to any other in Israel as well. And you can also see at the very far right there, BA.5 is starting to kick back up and is approaching the magnitude that Israel experienced with their Delta wave back in the fall of 2021. Now, again, putting that in context of the US, Israel has done dramatically better than the US, well below half of the cumulative per capita COVID mortality that the US has experienced. And again, Israel's done an amazingly good job at vaccinating and boosting its population, as well as somewhat better using non-pharmaceutical interventions, but not nearly as emphasized as those are in Japan and South Korea. And so again, that explains the difference between Israel, which is several times above what we saw again with Japan and South Korea. And this is now the US. So kind of looking at our experience, you can see in the top left, Omicron BA.1 was by far the largest wave, and now we've hit this kind of extended plateau, which is BA.2 running into BA.5. But you can see our hospitalizations, our ICU admissions, and now our death count are all creeping up here over the last 2 months. And there's really no sign of abating right now. And I would also highlight to the right, the bottom right, that mild Omicron wave, which in the US was responsible for the second highest peak in deaths compared to any other wave throughout the pandemic. So I would caution folks to take a grain of salt with the people who are talking about how BA.5 is going to be the last wave. We're finally immunizing everybody with infections, and we're not going to see any significant deaths or hospitalizations following. I would call to attention some of the things that were said last year as Delta was beginning to rise, and particularly pointing out these two wonderful shysters who throughout the pandemic have been minimizing the importance of epidemic waves and the impact, and this great prediction from July of 2021 saying that essentially deaths are over from the pandemic, and Delta is not going to be a big deal. And I would point out that since that date, we've lost 420,000 more Americans. And so unfortunately, we are far from exiting the pandemic, and we are looking at a fall, as I've mentioned, that's going to be probably as bad as, or potentially worse than the fall and winter we experienced last year. Thanks, Shelley.